Have you ever received an alarming call claiming your recent medical tests showed life-threatening heart problems requiring immediate surgery? Patricia Williams, an 82-year-old retired nurse from Sacramento, California, thought she was saving her life when a cardiologist called about critical EKG results. Within 36 hours, she had paid $14,000 for emergency cardiac procedures that never existed. Patricia's story reveals how fake cardiologists target seniors with fabricated heart emergencies, using their natural fears about cardiac health as manipulation tools. By the end of this video, you'll understand exactly how these cardiac scammers operate and learn the warning signs that could save your life and money. Stay until the end, because Patricia's experience shows how these heart scams can actually damage cardiac health through stress, making them uniquely dangerous among medical frauds. The critical heart call. It was a Wednesday morning in November when Patricia's phone rang with a call that would nearly destroy her peace of mind. She had just finished her morning coffee when her caller ID showed what appeared to be a cardiologist. Patricia was confused. She hadn't had any recent EKG tests, but Dr. Torres continued with such medical authority that she began questioning her memory. Maybe her primary doctor had ordered tests during her last visit. "Mrs. Williams, your EKG shows severe left anterior descending artery blockage with ST elevation changes indicating you're at immediate risk for a massive heart attack. Without emergency intervention, you could suffer fatal cardiac arrest within 48 hours. The words terrified Patricia. As a retired nurse, she understood medical terminology enough to know that ST elevation and LAD blockages were serious cardiac emergencies. Dr. Torres spoke with the confidence of someone who understood cardiology and the fear that heart attack warnings would create. The good news is we caught this before you experienced symptoms. There's an emergency cardiac catheterization procedure that can clear the blockage and prevent the heart attack, but time is absolutely critical. Building the cardiac emergency, Dr. Torres continued using impressive cardiology terminology that Patricia recognized from her nursing background, making his claims seem legitimate and terrifying. He described arterial blockages and cardiac procedures with medical fluency. Your LAD shows 95% occlusion with collateral circulation failure. This is what we call a widowmaker blockage because it's often fatal when it completely closes. The ST elevation pattern indicates the heart muscle is already showing stress. He explained that this type of cardiac blockage often showed no symptoms until the fatal heart attack occurred. Patricia felt fine and had no chest pain, which Dr. Torres said was exactly why these blockages were so dangerous. "I've been practicing interventional cardiology for 20 years, and this EKG pattern is one of the most dangerous I see. Patients with your exact readings have a 90% chance of fatal heart attack within 72 hours without intervention." The fake cardiologist created urgency by explaining that Patricia's age made the situation even more critical, and that emergency cardiac procedures had better success rates when performed before symptoms appeared. "We need to schedule your emergency cardiac catheterization for tomorrow morning. The procedure costs $14,000, but because of the life-threatening nature, I can process your insurance authorization today." The insurance deception. Dr. Torres explained that Patricia's Medicare would cover the cardiac procedure, but the emergency nature required immediate payment of facility fees that would be reimbursed once the life-saving surgery was completed. Emergency cardiac procedures require upfront facility payments because hospitals need to prepare specialized equipment and surgical teams. Once we complete the catheterization and submit Medicare documentation, you'll receive full reimbursement within 30 days. He provided specific Medicare policy numbers and cardiac procedure codes that sounded official. Dr. Torres seemed to have detailed knowledge of cardiac insurance procedures and spoke with authority about emergency medical authorizations. "I understand this seems expensive, but what price do you put on?" Patricia felt overwhelmed by the cardiac terminology, heart attack warnings, and pressure to make immediate decisions about life-saving surgery. Dr. Torres had created such convincing medical urgency that questioning the process seemed like risking immediate death. She agreed to the emergency procedure. Dr. Torres guided her through the payment process, explaining that the surgical facility required wire transfer to secure her emergency surgery slot. The cardiac surgery center requires payment 24 hours before emergency procedures to ensure specialized equipment availability. This is standard protocol for emergency cardiac interventions. At the wire transfer location, Patricia hesitated when asked about the payment purpose. Dr. Torres, still on the phone, coached her to explain it was for emergency cardiac surgery, which sounded medically legitimate. Patricia sent $14,000, believing she was preventing a fatal heart attack. Dr. Torres assured her that surgery was scheduled for 7 a.m. the next morning and provided pre-surgical instructions. "You're making a life-saving." Patricia arrived at the address Dr. Torres provided for her 7 a.m. cardiac surgery, only to discover it was a vacant medical building with no cardiac surgery center. The phone numbers were disconnected, and there was no record of advanced cardiac specialists. Confused and increasingly worried about her heart condition, Patricia drove directly to the emergency room. She explained that she was supposed to have emergency cardiac surgery but couldn't find the facility. "Let's do an EKG right now to check your heart. If you really had the blockages described." The emergency room EKG showed Patricia's heart was completely normal, with no signs of blockages, ST elevation, or any cardiac abnormalities. Her heart function was excellent for her age. "Mrs. Williams, your heart is fine. You've been the victim of a sophisticated cardiac scam. There's no emergency, no blockages, and no need for surgery." The devastating realization. The horrible truth became clear. Patricia had been completely scammed. The criminals had used her nursing background and cardiac knowledge to manipulate her into believing she needed emergency surgery for non-existent heart problems. Patricia learned that these cardiac scammers specifically target seniors because heart attack fears are universal among older adults, and medical terminology makes the scams seem more legitimate. The scammers had obtained her personal information through medical data breaches, allowing them to create believable cardiac emergency scenarios. The stress impact beyond losing $14,000, Patricia suffered significant stress-related health impacts from the fake cardiac emergency. The terror of believing she was about to die from a heart attack caused her blood pressure to spike and created real cardiac stress. Patricia's doctor prescribed anti-anxiety medication because the scam had created lasting fear about her heart health. She found herself constantly monitoring her pulse and worrying about chest sensations that were completely normal. The psychological impact was severe. Patricia, who had worked as a nurse for 40 years, felt embarrassed that she had fallen for medical fraud and began doubting her ability to make sound health decisions. The medical fraud investigators explained that Patricia had been targeted by a sophisticated operation that focused on cardiac emergencies targeting seniors. The scammers used detailed cardiology knowledge to create believable scenarios exploiting heart attack fears. The investigation revealed that the same group had scammed dozens of seniors using similar fake cardiac emergency scenarios. They had stolen over $900,000 by creating false heart emergencies requiring immediate payment. Police discovered that the scammers used detailed cardiac terminology, fake medical credentials, and legitimate-sounding procedure codes to create medical emergencies that bypassed rational thinking. Warning signs. Patricia missed looking back. Patricia identified several red flags she wished she had recognized. Unsolicited calls about emergency medical test results. Legitimate cardiologists never call patients about critical test results without scheduled appointments or prior medical consultations. Immediate surgery demands with same-day payment requirements. Real cardiac emergencies are handled through established hospitals with proper insurance verification and medical protocols. Pressure to make instant decisions about major cardiac procedures. Legitimate cardiologists encourage patients to involve family members and seek second opinions. Wire. Transfer requirements for medical procedures. Established cardiac surgery centers process payments through normal medical billing and never require wire transfers. The road to recovery. While Patricia never recovered her $14,000, her cardiac health remained excellent once the stress subsided. Her experience led to increased awareness about medical scams targeting seniors with cardiac fears. Patricia learned to verify all unexpected medical communications through her established healthcare providers before taking action. She realized that legitimate cardiac emergencies are handled through proper emergency medical channels. Most importantly, Patricia discovered that sharing her experience with other seniors helped her regain confidence and prevented additional victims who might have fallen for similar cardiac scams. Final thoughts. Patricia's story demonstrates that cardiac scams are uniquely dangerous because they create real stress-related heart problems while stealing money. These criminals understand that heart attack fears are universal among seniors, and that medical terminology makes. Remember, protecting your heart health means working with legitimate medical professionals, not paying scammers who exploit cardiac fears to steal money and create dangerous stress. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching,